Now let's discuss the fontanelles of the newborn skull. Fontanelles are soft membranous gaps between the cranial bones. They are very important because they help the skull to mold during delivery and allow for brain growth in early infancy. There are 6 fontanelles in total, 1 anterior, 1 posterior, 2 sphenoidal, and 2 mastoid. Now, the anterior fontanelle is the largest and the most important. It is diamond-shaped, also called the bregmatic fontanelle, and is located between the 2 frontal and 2 parietal bones. This one closes by 2 years after birth. If it appears depressed, think of dehydration. If it's bulging, think of raised intracranial pressure or hydrocephalus. Next, the posterior fontanelle is triangular and lies between the parietal and occipital bones. It's the first to close, usually around 2 to 3 months after birth. The sphenoidal fontanelles, also called anterolateral, are found at the junction of the frontal, parietal, temporal, and sphenoid bones, and they close early within 3 to 6 months. The mastoid fontanelles, or posterolateral, lie between the parietal, occipital, and temporal bones, and close between 6 months and 1.5 years. Clinically, always remember, the anterior fontanelle is your window to assess hydration and intracranial pressure, and finally, in terms of closure sequence, posterior closes first and anterior closes last. That's the golden MCQ point you should never forget.